Joining me now is the director of the CDC, Dr. Rochelle Walensky. Thanks so much for coming in this morning, Dr. Walensky. We know this could take weeks before you have all the data, as he said. But right now, at this moment, what do you know about the variant and what are your concerns?
Good morning. Glad to be here with you. You know, the first thing I think we should say is that we have about 90 to 100,000 cases a day right now in the United States, and 99.9% of them are the Delta variant. So we have an issue right now in the United States with Delta, and we have so many things that we can do about Delta, including getting vaccinated, including getting boosted.
But on top of that, we have Omicron.
Indeed.
Clearly spreading quickly. So what do you know about that variant at this point?
Right. So we know it's in, as of last night, about 15 states. We know we have, several dozen cases, and we're following them closely, and we are every day hearing about more and more probable cases, so that number is likely to rise. We know it has many mutations, more mutations than prior variants, and many of those mutations have been associated with more transmissible variants, with evasion of some of our therapeutics, and potentially evasion of some of our immunity, and that's what we're watching really carefully. What we don't yet know is how transmissible it will be, how well our vaccines will work, whether it will lead to more severe disease.
South Africa studies say about 2 times more transmissible. If it is as bad as it may be, even if it's not severe disease, what do the next 6 months look like?
You know, I think the next 6 months really depend on how we mobilize together to do the things that we know work. We know from a vaccine standpoint that the more mutations a single variant has, the more immunity you really need to have in order to combat that variant, which is why right now we're really pushing to get more people vaccinated and more people boosted to really boost that immunity in every single individual. We're really hopeful that our vaccines will work in a way that even if they don't prevent disease entirely, prevent infection entirely, that they can work to prevent severe disease and keep people out of the hospital.
Do you have a line? I know Dr. Hogue told me that they'd probably need a new vaccine, a variant-specific vaccine, if the level of efficacy got below 50%. Do you have a notional line that at what point we would need this variant-specific booster?
You know, I think efficacy, it's a really interesting, important question, but efficacy is sort of in itself on a spectrum. So is it efficacy at preventing disease entirely, preventing infection entirely, even if it just leads to a runny nose? Or is it efficacy at making sure people stay out of the hospital and prevent death? Certainly we want to do the latter absolutely first, and we'd really like to do the former as well. And those are the studies that are ongoing right now.
And one more thing, Dr. Hogue told me of those mutations which you talked about, he said it had the potential for a worst case scenario. We heard President Biden lay out the plans to combat this, but if it is the worst case scenario, do you fear that?
You know, I think we have so many more tools now than we did a year ago. We know so many things that work against SARS-CoV-2, the virus that causes COVID, regardless of the variant that we've seen before. I do think that that getting in a lot of immunity right now will be critically important. Masking up right now, we have 80% of our cases, of our counties that are still in high or substantial risk of disease with Delta. Doing all of those things will help prevent a more aggressive Omicron surge.
And the masking, but President Biden made clear, even before we know anything about it, that a mask mandate is not going to come back.
The CDC recommendations have been clear. We recommend masking in public indoor settings in areas that have high or substantial transmission, and that's over 80% of our counties right now. So, of course, those mandates and requirements are going to happen at the county level, at the policymaker level, but our recommendations have been crystal clear.
Would you rather see a nationwide mandate?
I would rather see people get vaccinated, boosted, and follow our recommendations. I'd rather not have requirements in order to do so. People should do this for themselves.
You know, one of the things about a booster, about a variant-specific booster, I know Moderna, Pfizer, Johnson & Johnson say they could all do this fairly quickly, within 3 months. Mm-hmm. But then you have FDA approval. Is there any world where you can see that moving much faster, given we've already been through this?
Yeah, you know, much of that I would have to defer to the FDA, but they're already in conversations about streamlining the authorization of this, of an Omicron-specific vaccine, partially because much of the vaccine is actually exactly the same, and really it would just be that mRNA code that would have to change. So those conversations are ongoing, and certainly FDA will move swiftly and CDC will move swiftly right thereafter.
President Biden also is going to restrict flights from South Africa and other countries in Africa and require testing. I was on a flight this week. Why not domestic flights?
You know, I think the rationale, we have to understand the rationale for why the international restrictions immediately. When those were put in, the only cases we knew about were in Southern Africa. And really those restrictions were put in to prevent new variants from coming to the United States and to protect the American people from new variants. The restrictions are what we do domestically. It's not about whether you have transmission on an airplane. We know we can prevent that transmission on an airplane through masking. So really the rationale for the restrictions would be different.
And isn't a key here getting vaccines into the arms of people who don't have them globally? How can we make that happen faster? Would this have happened if they were vaccinated in South Africa?
You know, we're working really hard to do so. We're not only donating the vaccines for free and providing more vaccines to the globe than every other country combined, but we at CDC work in 60 other countries providing on-the-ground assistance in vaccine safety, in vaccine delivery, in vaccine confidence, in vaccine effectiveness studies, all of the things. And we've been working in those countries for years, sometimes decades. So we have the buy-in of the local, the trust that you need to do those things globally.
Okay, thanks for joining us this morning.
Thanks for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.